So the primary endpoint, the clinical sensitivity, was 89%. So there were 36 patients in this cohort who had a positive companion blood culture at time of enrollment. T2 was positive in 32 of these patients. Moving on to the secondary endpoints, looking at the entire cohort of 152 patients who were originally enrolled, overall, T2 positivity was 45% compared to only 24% for the companion blood culture, so significantly more sensitive for detecting Candida 2 to 3 days after an initial positive culture. And if we look at the patients who are receiving or not receiving antifungal therapy, what we see is the superior performance of the T2Candida was realized in patients who are receiving antifungal therapy, where T2Candida positive in half of these patients versus only 21% of patients positive by the companion blood culture. And again, highly significant. Among patients not receiving antifungal therapy, T2Candida and companion blood cultures were equally likely to be positive. So if we look at the combined T2Candida blood culture results, sort of in this flow chart, here's our entire cohort with a positive blood culture to begin with. T2 was positive in 45% of these patients, negative in 55%, and T2 positive blood culture positive in both in 20% of the overall cohort. Both tests, the T2 and blood culture, were negative in 52%, but the key results are here, where we've got discordance. So T2 identified 37 patients as positive that were negative by the companion blood culture, and conversely, the companion blood culture only identified 4 patients who would have been missed with the negative T2.